with half of the 5 to 11-year-old children in the province still not vaccinated, we're seeing some pushback from parents and teachers on the announcement earlier this week that youth sports tournaments will come back at the start of early next week. So should we expect to see an increase in transmission? And if so, are you okay with that? And if you're not expecting the numbers to go up, why not? And in English and French, please.
Just apropos of your last question, I was thinking of Maya Angelou, who says, you know, do the best with what you know, and this is a poor paraphrase, do the best with what you know, and when you know better, do better. And I think that's always been our mantra with my team, about trying to adapt to what we know as we go. Yeah, I was actually a little taken by surprise by that. We know that for some children that activities in sports and dance and other things is a really important part of their growth and development. And as you know, we have prioritized youth sports and activities for that very reason. I think as adults we can give up a season of having our old-timers hockey tournament, but as children those can be really important events for them. So we have prioritized them. We have measures in place, and we worked with Via Sport to make sure that those are are out there with all of the leagues. We've worked together a lot through this pandemic. We meet regularly with the multiple sports leagues, especially for children and youth. And so, yes, I do expect that they will be followed, that we have those guidance in place. It involves making sure that the adults in those settings are vaccinated and doing the right things, and so I don't expect there to be a large increase in cases. I do know that some of the school tournaments, that the school system and teachers and the school districts are working together on whether those are viable right now or not, and that's more because of what we are seeing, that there's strains on our schools across the province because of staff being off with illness particularly, and we've seen some functional closures. So that is up to the school system to try and determine what's the best way to manage school-based sports and competitions, but I don't expect to see an increase in transmission related to youth sports, and I expect that everybody will follow the guidelines that we've put in place to try and do our best to minimize any risk.
And just to say, you know, youth, of course, represents those 15, 16, 17, and 18, and if you look at the data that we look at every day, it's 17 and 18-year-olds and 16-year-olds who have some of the highest levels of vaccination of any age cohort in the province. And so I think it's important, especially in sports where it's possible. And there are the practical considerations in school sports that Dr. Henry has spoken about, that we return to that with everyone following the COVID safety plans that need to be in place for those events to be successful. And so I want to acknowledge that a lot of people involved in sports in BC, and a lot of people who sort of graduate from sports systems, whether it be 12-year-olds for little leagues or 17 or 18-year-olds for, let's say, coming up would be the high school basketball tournaments, and in BC these are important moments in their lives, and some people have lost those moments in the last couple of years, and so it's important that we act safely and follow public health guidance, but it's also important that these events take place if they can be done safely, and so that's the direction that public health has given here, and I think it's a good direction.